Welcome to Lyme disease, the Great Imitator. Here's your host, Dr. Darin Ingels.
Lyme disease is actually a bacterial infection that's transmitted through a tick bite, and it can cause very serious health problems if it goes undiagnosed. Lyme disease is the fastest growing epidemic in the world, affecting more than 300,000 people in the United States and about 65,000 people throughout Europe each year. Lyme disease is often referred to as the Great Imitator, as the symptoms are vague and often resemble many other types of illness. Lyme disease is also difficult because getting diagnosed can be very challenging. Lyme disease can often be confused for many other types of syndromes, including lupus, rheumatoid arthritis, influenza, mono, multiple sclerosis, Parkinson's, Alzheimer's, and many other different conditions. So how do you know if you have Lyme disease? Well, lab testing can help, but the problem is a lot of lab tests aren't very accurate and they often miss people who have Lyme disease. There have been more than 100 different symptoms associated with Lyme, but there are some symptoms that are consistent amongst most people who have Lyme disease. And people with acute Lyme disease can look a little bit different than those that have chronic Lyme disease. I've been a Lyme patient myself and experienced it firsthand, but I found a way to heal myself naturally, and I want to help share with you how to help regain your health and live your best life. So what are the symptoms of Lyme disease? Well, in acute Lyme disease, you can get a high fever, headache, joint pain, especially low back pain, swollen lymph nodes, numbness and tingling in your hands and feet, muscle aches, debilitating fatigue, and you can even get a condition called Bell's palsy where one side of your face starts to droop. The symptoms tend to come on quickly and you feel acutely ill. The one characteristic sign is what's called an erythema migrans rash, and this is actually the site at where the tick has bit you. The rash itself looks like a target or a bullseye. It tends to start small and then spreads over the course of several weeks. The rash itself is not painful, itchy, or raised, unlike a mosquito bite, and there's no other organism that causes this rash, so if you see it, you know you have Lyme. Unfortunately, many people who get Lyme disease do not get this rash. Chronic Lyme disease can look a little bit different. Although you can see many of the same symptoms as an acute Lyme disease, you may also experience brain fog or short-term memory problems, debilitating fatigue, chronic headaches, difficulty walking, poor balance, muscle weakness, stomach or bowel problems, hormone imbalances, especially an underactive thyroid problem, poor sleep or restless sleep, sensitivity to light and sounds, feeling frequently flushed, and other unexplained skin rashes. So if you've had any combination of these symptoms and you haven't discovered why you feel the way you feel, it's time to find out if you have Lyme disease. Now it's time to go to my website at dariningelsnd.com and take my questionnaire. If you score above 45, it's highly likely you've been exposed to Lyme disease. I also recommend you start my 5-part plan to overcoming Lyme disease as outlined in my book, The Lyme Solution.
To discover if you have Lyme, explore our Lyme symptom questionnaire at dariningelsnd.com.